minutes. If anyone wants to use the chat to introduce themselves, that would be lovely. So we know we've got in the virtual room. So I might just start, actually. So today, we're just going to talk to you a bit about the application. So it's an opportunity for you to ask any questions, but also an opportunity for us to go through everything with you. There's lots and lots of resources. The questions are on their website already, so you'll be able to have a look and get prepared before applications open on the 1st of October. But there's lots of guidance on a website as well, if you want to have a look. So we'll just do a short introduction into Lucy and me while we're here today. So I'm Polly. I've been around the programme, which feels like forever, because it actually is. I've been around the programme since it began in 2016. I've probably got, if you cut me open, I'm probably like a stick of rock, and I've got a clinical entrepreneur programme running through me. So I started out as a project manager for medical innovation. Now I'm national programme lead, and I lead on the curriculum, the strategy of the programme, and the operations. So I'll hand over to Lucy, and she can do a quick introduction too.
Hi everybody, thanks ever so much for joining us this evening for this CEP prep session. So my name is Lucy Dentis. I'm Programme Manager for the NHS Clinical Entrepreneur Programme, the Patient Programme, and our new Dementias Innovator Programme, which we're very excited about. So I lead on all the comms engagement and all the digital infrastructure, as well as working closely with Polly around all the operational side of the programme. So thanks ever so much for joining us this evening. I think we're going to go through a few slides, but really we're going to allow this session to be opened up. So if you've got any questions about the application process or about the programme in general, please feel free to pop your hand up or put any questions in the chat. Okay, thanks, and it's nice to see you all.
Do you want to start sharing and we can start going through? If you want to raise your hand up to ask any questions while we're going through, please do so, or you can use the chat as well, but then we can have a look at those after. Lucy might be able to multitask and do the slides and the chat at the same time, but we have just had an event marathon, so please excuse us if we're a bit September's a horrendous month. We both got back from Newcastle this afternoon, so yeah, we're a bit tired, so yeah, I'll begin. So any questions, just raise your hand if there's anything you need clarification on, or use the chat. Right.
Okay, is that all right? I can see Claire's face, so Claire, if you just nod. Yeah, Claire's happy. Okay, great.
So do you want to do the next one, Lucy? So the Clinical Entrepreneur Programme has been in existence for the last 8 years, and it's grown hugely during that time. It was introduced because there was lots of pathways for junior doctors at that point to pursue different sorts of careers. So if they wanted to do training in education or academia or research, but lots of entrepreneurs back in sort of 2013, 14, if they were looking at startups or doing anything entrepreneurial, they weren't supported by the NHS to do that. So Tony Young, who founded the programme, saw that lots of junior doctors at that point were leaving to pursue other careers because they couldn't do what you would describe as a portfolio career back then. So the programme began in 2016. We had 104 junior doctors at that time, and now we're in year 8. We had our biggest cohort this year of 227 NHS staff. So during that time, all NHS staff have become eligible as the programme has grown. we also support a cohort of patients, which we're doing again this year. So if any of you are patient entrepreneurs or thinking about the Dementia Innovators Programme, they are run as separate programs, but largely you will all be able to participate in the main clinical entrepreneur program content and events and curriculum that we run. So the program, as I've said, was put in place to support healthcare staff that had entrepreneurial ideas or were seeing problems in their NHS trust or in their workplaces that they wanted to solve. So, and the program is, until you really experience the program, it's quite an unusual thing. So it's, if you imagine a Venn diagram and you imagine 3 circles of, we probably should do this as a slide, Lucy, of learning and development as one of those circles, business support as another, and then accelerator program functions. And we sort of sit in the middle there. So it's not a traditional learning and development program, although there is a lot of learning and curriculum opportunities for you to experience. But we also do, we also try and enable exposure to industry and to other sorts of skills that will benefit you both in your day jobs, but also benefit you too when you're developing your innovations. So should we go to the next slide, Lucy? I don't know if I've mentioned everything on that slide, but it was there to read and Lucy will share on the website. So just so you know, we will be beginning recruitment for cohort 9 in the next couple of weeks, and applications open on the 1st of October, close on the 29th of October, and then we begin our review and assessment phase, which takes a really long time. So applications are assessed by 3 assessors. So there'll be if you apply, your application will be looked at by an industry person, a clinical entrepreneur, and someone clinical, and then someone in the NHS. Our recruitment process is really rigorous. So all assessors sign NDAs, and they access your applications. Not all details are shared on the submit platform, which you will see. And then after assessors have looked at it, then we do a whole program assessment of applications, and that includes NHS England. So there is panel reviews of all applications that starts probably at the beginning of December, and you will be notified in early January through the portal for you if you're successful or not. And then the programme officially begins on March the 5th, 2025. Should we go to the next slide, Lucy? I don't know if I've missed anything out there.
I was going to just jump in there because I know this slide says cohort 9, but it does, all these dates do also refer to the patient programme and the Dementia Innovators Programme. So they all run along side by side. So all those dates are relevant to the other programmes as well. Just chucking that in there. Okay,
and also, if you're here to think about the patient programme or the Dementia Innovators Programme, they're separate forms for those, which you'll find on the website, but the questions are largely similar. So yeah, you can apply via our website, which will then take you through to a portal where you can go. Lucy, it might be better for you to do this slide because she's our tech guru, so she'll be able to talk you through it better than I can.
I think guru is a very that's very generous, Polly. So basically, if you do go to our website, you'll see each of the programs have got their own dedicated page. They've got their own dedicated application page as well. It's just got all the frequently asked questions. It's got all the guidance material, and it's actually got all the questions there as well. On the 1st of October, you'll get basically the live link will go live, which will take you to the application portal and all the questions. You do need to register, so you need to create an account. Please make sure you use a valid email address. I have had people who have created just a random email address, which is no good because then we can't keep you updated on your application. So that's just a bit of a tip that we've had from people in the past. So yeah, go to our website, and the first you'll find the live link there. Yeah, okay, I'll go to the next.
And just to add, when you create an account, you can save where you're up to and then go back in if you want to start it off and then address each question separately, or however you decide to approach it. But you can just make sure, so, as Lucy says, sometimes people don't use an email address they access regularly. So or sometimes they put in the incorrect email address. So just make sure you check everything as you apply. I know that's a really stupid thing to say, but you'd be surprised how many people do input things wrong, incorrectly on their application. So this is just some more information about completing the application. There's a whole FAQ section on our website. So you'll be able to, if you're applying for the Clinical Entrepreneur Programme, you have to be an NHS staff member, or, for example, work in a pharmacy that provides NHS services, or you're a GP, because they're employed differently but are NHS staff. If you're, just to clarify, if you're a startup or a company contracting into the NHS, that is a different kind of service. So those sorts of people are not eligible, but all the information is on the website. You're also eligible to apply. Bianca, I've just seen your message. Yes, medical students are eligible. So medical students, as they have a direct route into the NHS. Similarly, other sorts of students, nursing students, pharmacy students, AHPs, physio students. So students that will have a direct route into the NHS are also eligible. So in terms of a medical career. Oh, Lucy, you've moved on too quickly. Yeah, so check your eligibility and read the FAQs and use a valid email, as I've said. There's all sorts of guidance around what to include in the questions, but you have the word count is small. So I think there's a bit of refining of your answers you'll have to do. So it might take you a little while. And there's also, in some of the questions, they allude to, for example, how your application is relevant to the long-term plan and other policies. So yeah, just make sure you've done your homework in terms of thinking about your idea or your innovation and relating it back. You have to complete the application in full. You can't leave any sections blank, because if there are any blank sections, they're not assessed. So please make sure that when you're about to hit the submit button, you check to make sure every section is complete. There's also, which is the people find the most scary bit, but is the video pitch. But we'll be going through that in a few slides along. You can't upload a video to the portal. You have to record directly to the portal. So make sure your sound is enabled, and you can go back and re-record and check it. So you can do lots of takes if you want to with your video pitch. I don't know if you've been on previous sessions, but it's best to do it as a live video rather than using slides or anything that's sort of pre-recorded, because you've only got a minute to do it. So as soon as the minute's up, the video stops. And assessors tend to prefer like an authentic view of the person they're assessing. So yeah, I would avoid using anything apart from your iPhone or your laptop with your webcam enabled to do your video. So Lucy, anything you want to add to that section, or should we move on?
Yeah, just really quickly, there was a question around medical students. The only exception there is actually Northern Ireland. So there is a little bit around medical students in Northern Ireland. They are not eligible, I'm afraid. But England, that's completely fine. Scotland, that's completely fine, but not Northern Ireland. We do actually have that on the website. There is also, if there's any Northern Ireland potential applicants here as well, there is also a little bit of further criteria that's required, which you can find on our website as well. Some of these questions aren't, so Polly mentioned the long-term plan. There isn't as much emphasis on the patient and the dementia innovators program. Obviously, dementia is part of a priority already. So there is a slightly lighter touch with those applications. But again, you can view that in full on the website as well. So yeah, I'll move on to the next slide, Paul, which is
yeah, so as we said, or as I said in the beginning, there's lots of resources on the website to support you and run through each question with you. If you have any questions, you can email us. If there's anything you're not sure about or you want clarification on, just send us an email to the inbox address, which is cep@aru.ac.uk. I'll chuck that in the chat a bit later. Just to note, it's an individual application. It's not an application based on your innovation. It's an application based on you. So, and we look at in assessment the person, the problem that you're solving, and the solution you have to that problem. The solution doesn't need to be developed. It just needs to be scoped out as much as possible and your research done. So you can apply just with an idea and that solves a great problem. So we don't take into account the stage of the innovation necessarily, but we do take all of those things into account. If you have co-founders that are part of the NHS or patients or dementia innovators, you have to do your own application. So we do not accept joint applications. And also, don't forget, you need to have your letters of support ready to upload when you submit your application. We can't accept them at a later stage. We're a really small team, so all of the administration around applications is huge. So we can't then upload the letters to the system separately. So it's not possible. So make sure you have your letters of support ready. They can be from colleagues that you've worked with before, people that you've worked with on different projects. Basically, they're a letter of reference to say you are a fine upholding citizen and you will be supported by them to join the programme. Ideally, they would be from your line manager, but they don't necessarily have to be from your line manager if you can't facilitate that in time. They could just be colleagues or previous people you've worked with in your career. So next slide, Lucy, or anything, Lucy, to add on that? No? Excellent. So for pitching, there has been some sessions on pitching before, so the recordings are uploaded to the website. But yeah, just remember when you're pitching to tell us a little, it's quite hard in 60 seconds, so that's why you'll have to do some practice. Tell us a little bit about yourself. So people are interested. Tell us who you are and what you do. Tell us about the problem that you're trying to solve and what you're trying to do. But it can be really, really brief. It just needs to be concise and considered. And Lucy's, there's a really nice diagram here. I don't know if you want to talk more about this, Lucy, as you put this slide together.
We've actually got a great session we did probably about a year ago with Anton Lin, and he's actually he works for a VC, doesn't he, Polly? So he is used to listening to people pitch, and he doesn't want all the acronyms, he doesn't want all the detail, he wants the key points. So he actually helped bring these pieces together. On the next slide, we also talk about Finding Nemo. You'll understand in a minute. But we have that recording, so I'll make sure that is shared with everybody on this call because it is worth having a look. On top of that, we actually did a storytelling and pitching session in June as part of our CEP prep learning sessions. That is available on the website. It's with John Torrens, and it really does focus you in about what story you're trying to tell and what point you're trying to get across. I think a lot of it is about how you pitch and tempo, the way you're trying to get your message across as well. Please don't take a massive breath and talk at 1,000,000 miles an hour for 60 seconds. We have seen that. It doesn't go in. It's not a good pitch. Don't try and be too gimmicky either. Just really have a think. As we've already said, you can re-record as many times. So you can go on the portal, you can go watch it back and go, no, that's a disaster. Or actually, I'm really happy with that. Re-record or not re-record, save it. But do have a look at these pitching videos. They're really good. And actually on the website, there's quite a few videos you'll see from our previous clinical entrepreneurs. They might be a little bit longer than a minute, but they're really good. They get across the key points. The tone and the pace is really good, and it gets across a really strong message. And that's what you're trying to get across in this application. Okay, you don't want to go into the like really deep detail or any IP or anything. We don't need to know about that in this pitch. So I think I've just waffled on there, so I've gone definitely over a minute there. So yeah.
Also, it's really, really useful just to practice. So practice on your mum, practice on your friends, practice on the cat, like get used to saying the words out loud. You don't need to spend tons of time practicing, but yeah, having a go and thinking about what you're saying in your head and then watching it back a bit is also really useful, because you'll think about the things you could take out, the things that need to go in, and it'll help you refine your pitch as you're going along. So you can do that straight onto the hub, or you can just record onto your phone and then, or iPad or whatever, and then rewatch back. Sometimes people read they write it all down and read it out, which unless they've learned it a bit and there's been again some practice, sometimes it there's not the pace or it's too quick, or so yeah, having a go at doing this. So I appreciate some of you might not have done things like this before or presented to people, so it's a bit of a difficult skill, but the practicing will really help. Someone's just put a question in the chat. Could I ask a question on the video side? I have a product to demo which runs on a PC and can show it whilst talking over it. You can do that. I would probably suggest just talking about the product rather than demoing it, because you'll describe it in your application as well. This is an opportunity for assessors to meet you. So yeah, I think about that as a point rather than demoing your product, because it's about not just about the product, it's also about you. So also you go on to add, you mentioned it's not possible to upload a pre-recorded edited video. This is not what Dr. Young implied on the session he was talking. Right, so what Tony was trying to explain was that through the portal, you can upload, you can record straight onto the portal and watch back. If it's not quite what you're after, as Lucy said, you can go in again and do it again. So that's what he means in terms of editing it. So you use the portal to edit your video. You just try again and try again until you get it. You're happy with it. Is there anything else to add, Lucy? Or should we move on to the next one?
No, I will move on to the next one because that's Finding Nemo.
Do you want to do this one?
I can. It's quite straightforward, really. Let me just get to it. Oh, is this the Finding Nemo? Sort of a fun. Let's go to the next one, I think. Here it is. So basically, this slide is just a bit about storytelling. And this can help you when you're pitching. So the whole Finding Nemo is basically what the situation was, what happened, the outcome, and why things are better now. So I mean, you can read the slide, but it's basically, I think when you're pitching, you need to sort of set the scene. So focus on the problem that you're trying to solve, okay? And then what your solution is, or what your idea is, and why it will be better, why your solution will lead to better outcomes for patients or the NHS. And that's basically what we're asking in the pitch. We're not asking for like really deep dives into your IP. We're not asking for a massive slide deck about it. We don't want that. It's almost like a hook in to pique people's interest for a second conversation. And then you go from there. So don't try and pack everything in. If you've got some key stats, that's great. But don't, I guess, don't, oh, I'm not going to say overthink it, but don't try and put too much detail on when really you're just trying to get people's interest. You've clearly done a bit of research. We ask about research in a different question anyway. So we're trying to get a sense of you, your passion for this idea and or this problem that you've found and you've identified, and your solution. So this is actually a really nice little way of thinking about it. So obviously you can read through this. I will obviously share the proper video with Anton, who explains it a lot better, and he goes through why this is the Pixar pitch and how important it is and why Finding Nemo did so well. Now, I know that came out quite a few years ago, so I'm showing my age a bit, I guess, but it's actually a really great way of thinking about your pitch, so you don't get kind of bogged down, I guess, in too much acronyms, detail, things like that. Polly, have I done that justice or not? I'm really sorry, I've got a stinking cold.
So again, as with the application form, the pitch is, because there are no interviews and you're appointed via your application, the pitch and the application is an opportunity for us and the assessors to get to know you and your understanding of the problem you're trying to solve and what you plan to do about that problem. So as I said, it's the three-pronged approach to thinking about the application. So you understand what we look for in an application. So do you want to go on to the next one, Lucy? Oh. So as I've said earlier, if you want to contact us, there's our email address. So if you've got any application queries or you want to go through anything, please just email us and we'll either answer your questions or arrange a time to speak to you. Does anyone have any questions? There's some general program information. The program is a year long. We have 8 in-person events that are also blended, or you can watch later. Alongside the program, you will get a mentor, which we ask if you think you need one. So you don't necessarily need to have a mentor, but we do recommend it if you're really working on your idea during your time. So we ask that you meet with them 4 times a year, so a minimum of 4 times a year. We ask that you attend a minimum of 4 pit stops, so that can be online or virtually. Pit stops sometimes happen at weekends as well, so we try to have a balance of, so I know some of you will get study leave and you'll be able to you might take annual leave to come along, but we try to have a balance between midweek and weekends, so we make sure that we make it as accessible as we can. They run all throughout the UK, and we do offer support with accommodation and travel. So I know this is a free to attend program, but we do realise attending these things come at a cost, so we do try to support you in some ways. What else is there? The attendance. So just so you're aware, we've said on other things, we take no IP stakes in your innovation. If you've got, there might be particular IP clauses in your employment contract, so there might be some things that you need to think about with your trust, but we can support with that too. We run a whole host of things outside of the normal pit stops, so there is lots and lots of content and opportunities for you to engage with. So, for example, we run a number of industry days. So this year we've been to IBM, which has been amazing, where we looked at AI. IP is intellectual property, Claire. So basically, it's your KFC recipe that you will think about protecting. Some things can't be protected, but we offer suggestion, we offer support on you thinking about your IP. So we do group sessions, we do one-to-one sessions as well. We've got partners, we've got some law firms that partner with us that offer support to clinical entrepreneurs free of charge, which is amazing. So not just around IP, but if you have other legal questions around contracts, things like that, employment law, any sort of legal questions, they support clinical entrepreneurs free of charge, which is amazing. So yeah, we have industry days, we have all of those one-to-one and group sessions. We have sessions on regulatory. So you get access to regulatory experts free of charge. You get access to finance and accountancy experts free of charge. And we have business planning. So we have a number of opportunities for you to talk to people to help. So you can gain assistance on accelerating your idea and next steps and things like that. So there's lots of business planning. There's lots of industry opportunities. We have overseas trips. Next week, a group of clinical entrepreneurs are going to Amsterdam. We've been to Texas. We've been to San Diego to conferences. We've been to Harvard. We've been Denmark. Lots of Europe, Germany. Lots of places in Europe. Lots of places all and that's up to you if you can go. Sometimes there's support offered with that as well if people are not able to fund it themselves. So it's a really, as I said in the beginning, it's a really unusual program, and there's lots of networks. So alongside all of that learning comes a huge ecosystem of people that you probably would never have the opportunity to meet normally in your everyday life. So we have some over 250 mentors that are from the NHS, from industry, from startups that offer their time and support to you free of charge. We have we're connected with our partner organisations. We're connected into other NHS programs. We're connected into NHS trusts and things like that. So the ecosystem is quite incredible and unusual and quite large as well. Yeah, I think that's, I'm not sure if I've missed anything out about opportunities. I've gone on a bit there, but it is actually a really great program if you've got an idea you're really passionate about exploring, and it will give you the learning. I mean, we won't do any of this for you. We can connect you to all the right people. We can provide you with the learning and the information, but ultimately developing your innovation is up to you. But yeah, it's there's lots and lots of opportunities for you to, as a learning and development opportunity. I think it's amazing. You learn loads about projects, you learn loads about comms, you learn loads about branding, legal and IP. So most certainly it will transform how you approach your day job, because it has me. And lots about teams and leadership. We do lots of on that. But if you're thinking about applying to really accelerate a idea that you have for a problem that you've seen you'd like to solve, you're in the right place. Lucy, have I missed anything off? Does anyone have any questions more around the application or
I think
anything
Stuart did have his hand up, but he might have.
Well, it was.
Oh, there you are, Stuart. Hello.
Yeah, it's just a couple of general questions, really. So the first one is, if you said this application has to be for an individual, but if, for example, in my case, there's three of us that have worked on an idea together, you don't want three identical applications with three, videos from separate people all saying the same thing.
No, we
So
don't.
would it be best to sort of pick a representative lead to attend apply for the program and then work with the team outside?
I think so. We often get this. This isn't a new. We often get teams wanting to get on the program, but because this application is for the individual as well as the idea, we do ask for separate applications. So no, you're not going to say the same thing in your pitch, but you can say about the same idea, but in a different way. And I think that's really important. I mean, we've had a couple of complete duplicate applications, and that's a no-no.
Yeah.
So while you might have the same idea, you've probably got a different take on it based on maybe your career or your speciality. So put it from your point of view, if that makes sense. So make sure they're individual. But as many people from your team can apply, but as long as they apply separately, yeah.
Thank you, Lucy. And just while I've got you, just one more general query is, what are the most common pitfalls in the application process? Where do most people fall down? What, the things to look out for?
Not focusing on the problem enough and not doing research around it. I would definitely say that's the thing. So not actually doing even just a basic bit of desktop research about what else is out there to look at that problem. That is really, really important. That's something we see all the time because they haven't even just done a basic Google search. So they don't know what's out there. So make sure you do a bit of research. Look at our videos that when we talk about researching your innovation, focusing on the problem, it is really important. The pitch is really important as well, isn't it, Polly? Like we said, please don't go a million miles an hour without taking a breath. Think about what you want to articulate in that pitch and really why you want to be on the program. Because some people get to the end and we say, so why do you want to be on the program? And it's a bit like, there's nothing really there. And you think, well, we really want to know a bit about you and how this will actually positively impact you and potentially your career or your idea. So really think, I think they were the three kind of main areas, weren't they, Polly? Have you got anything to add to that?
So there's a couple of things I would add is, as Lucy said, assessors will Google. So they'll go. So just say you're applying with type 2 diabetes diet solution, they'll Google that. If you say there's no other people in the market wanting to do the same thing, and they do a Google search and they find someone. Yeah. So there's that sort of thing. So do some basic research, understand your competitors, understand why you think you're a bit different to them as well. We don't exclude anyone just because there are similar ideas. We have lots of clinical entrepreneurs working on similar things. It's just that it's what you put in the application. So you're aware of there's like 50 other companies out there doing type 2 products for people with type 2 diabetes, for example. That's just something I've chucked out there. But also, again, think about, some of you might have medical devices, some of you might have different solutions that you don't necessarily need to think about you always need to think about the population you're serving, but just say you've got a digital solution for old people to order meals, say, for example. Like, you've got to realise that 25% of the over 70s don't use digital solutions. So you've excluded a quarter of your market there straight away. So thinking about your audience and your users as well is really important. And who will buy your or commission or use your solution. Because often, if you're thinking about the NHS as maybe your as your customer, the NHS necessarily isn't going to be your user. So your patients might be your user. The NHS might be your user, but generally the NHS will pay for it, and then the customers will use it. So you have to, patients will use it, for example. So you have to think about it in different ways. And Harry, there's recordings about doing a lean canvas as well, which is probably a really good place to start. So if you go onto the website, you'll have a look at that, and it'll help you unpick your idea a bit before you start writing your application. Yeah, sometimes people also, there's a thing where people apply with a really big idea, which is amazing. You know, like I love a big idea where people want to change the world, but like they never get down to the nuts and bolts of how they're going to do that. So you, like, for us, it's important to see that you've thought about, right, I've got this big idea, but I'm going to unpick it and do this bit first, and then this bit, and then this bit. And I know that's really difficult in 200 words per question, but it helps us to understand that you are thinking about, and you know what like your next steps and what you're trying to achieve. And there's also, every year we get trends. So every year there's different trends. So when we first started, there was a ton of locum apps that came along, and they've moved. After COVID, we moved more to workforce and well-being. So yeah, who knows what the trend might be this year, which will be quite interesting to see. But obviously we've moved more to so we've moved from app-based things maybe to apps and other things that have like platforms or other services attached to apps, which is a bit of a move as well. So yeah, there's been trends and changes along the way. But if you're thinking of doing something in a crowded marketplace like well-being or mental health, like, it's good to understand why you might be different and why you might succeed when there's lots of other products or services or things that could be similar to you. It's also important to think about, not all clinical entrepreneurs are doing something that's commercial. Lots of entrepreneurs are thinking about changing pathways and changing the way services are delivered, are doing things internally, internal projects rather than commercial solutions as well. Sorry, I've gone on a bit there. It's interesting. It's interesting. Like every year, obviously, I've been around since the beginning, and it's interesting to see. We've had a bit of a shift as well from people with existing solutions that are quite well established to more of entrepreneurs that have just ideas that they're taking forward. So yeah. Any other questions?
Can you hear me? I had a couple of questions actually. Just two very specific questions about the application and one more general question. One was just the reference letters. Are they assessed, or are they just to check that you've got reasonable references? And the second question about the application was, is there any information anywhere about the weighting, for example, the weighting of the pitch versus the paper application, and the weighting of, you know, the person versus the project, person versus the actual project versus the idea, the problem it's trying to solve?
So the letters are basic. Is think of it like you're applying for a job. So if your letters will be to just prove that they think that person that you've worked with before or whatever, they think you're suitable to apply. So it could be from your boss, it could be from a colleague. So think of it like you're applying for a job, and they're a letter of reference.
Perfect.
In terms of the weighting, questions are, there's a small scale for assessment, isn't it, Lucy? I don't know if you've got anything to add. I'm just thinking about how many questions there are in relation to the application form.
Basically, the application is scored on 5 different criteria. It's impact, it's personal capacity, and 3 others, which I'll get to. But the video pitch falls into some of those criteria. So we look at, that person as well as the innovation. So let me just read them out so I can tell you.
And also, while Lucy's doing that, there's a question on there that says, why do you think we should accept you onto the programme? Or I might have paraphrased that slightly. So when you answer that, think about your idea, think about what you've done in your workplace, any projects you've worked on, why innovation is important to you. Really use that as a way to sell yourself to us, and what you could add to the program as an individual. And that might be your knowledge or enthusiasm around different topics. You might have a specialty interest, you might have expertise that is quite unusual. It could be a number of different things. It might just be your sheer passion for innovation, but try and get that across in that question, which again, 200 words, it's quite a small space, but yeah, use that as an opportunity to sell yourself to the assessors. Lucy, you carry on.
Sorry. So it's clinical impact, priorities of the NHS, viability of innovation, personal motivation, and personal capacity. Capability. With the patient program, it does just tweak on one of those a little bit about lived experience, which you can see on the application form as well, because we want to know how your lived experience has impacted and made you create this great innovation or idea. So that is just tweaked slightly there. But they're the sort of main 5 criteria, and we look across the assessed questions to score those criteria. So I hope that's of help. That's why we say, why do you want to be on the program? And if nobody puts anything, or it's really a bit flat, you think, well, maybe you're not really that motivated. So that was like some of the key feedback we do get.
Okay, that's really useful. Thanks. And then in terms of the actual the priorities of the scheme, I know you accept both things that are kind of in their infancy versus things that are kind of well established. Have you got has the scheme got a priority this year in terms of leaning more towards one versus the other? Because my situation is I've got one established thing that's running, but we'd like to scale, and one thing we're launching, but is very much in its infancy. So I suppose we're just me and my co-founder are trying to think about which one is best to run with.
No, I mean, we accept from early stage idea, this is for the main program, all the way through to an idea that's already, or a product that's already out there. We don't have a priority on where we're going to accept more applications at all. If there's a good application, if there's a really good application, you're going to get on. Basically, we don't have, well, not formally an upper limit, do we either, Polly? So, if there's great applications, we want to take you, want to bring you onto the program and hopefully support you. Yeah.
Okay, great.
It's important to remember this is a workforce development program, so it's not a accelerating your innovation program, it's a workforce development program. So we're looking to support the workforce, whether they've got something that's really early stage or just an idea, as well as if you've got something that's in the market. So yeah, there's if you look on the website, you'll see from all of the case studies and video pitches that there's not really a one-size-fits-all clinical entrepreneur either. They're working on a variety of different, quite diverse ideas and innovations, and they're all at really different stages as well. So if you have a look, you'll be able to see that get an idea of the things that are accepted onto the program as well.
Perfect. Thank you so much. That was really helpful.
Yeah, and I will post those in a second. Vicky's just got a question about limits on the patient entrepreneur program. Yes, Vicky, it's slightly different because it is a smaller cohort. So with the patient program, if you don't already know, we actually work really closely with a fantastic team at the patient and public involvement side in NHS England, and they support the innovators there. So it is a smaller cohort. It's generally between 10 and 15 people for that cohort, and the same will be for the Dementia Innovators program as well. It'll be a smaller cohort because there'll be that kind of wraparound support. So I hope that's answered the question.
In terms of the main clinical entrepreneur program, if you're working in the NHS, as I said last year, we had I think it was 195. So every year it gets a little bit bigger, and there will be obviously and that sort of converted to around 40, was it around about 40% of total application numbers, and it translates. There's no reason why it does, but it's translated roughly around that amount every year since it began. So that's not to say if 60% of you were amazing, we wouldn't accept 60% of total applications on. So yeah. So I think we and last year was our biggest cohort in terms of application submitted as well. So so we've got a question from Vicky in the chat. I don't know if you want to open your mic and ask the question, Vicky. I don't know. I'll read it out anyway if you're not able to. I'm a lived experience trainer for Oliver McGowan. Would that come under an NHS or patient? I'm not. What is Oliver McGowan? Vicky.
Hold on. Can you hear me okay?
Yeah.
All right. So I trained as a Oliver McGowan lived experience trainer. So I go into the NHS and I'm contracted into the NHS to provide information about lived experience of autism. So I'm not quite sure which side of the fence I sit on, to be honest.
So you've just said you are contracted into the NHS. So are you contracted like an employee, or are you contracted as an organisation?
That's a really good question. It's very woolly, for the best way of putting it, because we've done the training, but we haven't actually started providing the sessions yet in my particular area in York. So I haven't really had a chance to sort of work out where I am with it. All I know is that we have to submit an invoice and then eventually we get paid. Okay, it sounds like you don't have an employment contract with the NHS. You could email us about it and we can check for you. But if I think that you would apply for the patient program. Right, that's fine. What you've said. Yeah, but yeah, if you want to email us, we can clarify and just give us some more information on email. We'll be able to clarify that for you. Super, thank you very much. Any other questions? We've got another couple of sessions. Lucy, someone asked for the criteria again for you to put. Have you put that in the chat? Sorry, I'm just checking.
So it's actually all on the guidance document that we've got. You can download and you can get all the questions and top tips and everything. It's on the first page there. So I've just linked that in the chat. So please just take that away, and you can find it just on the Apply Now page as well. So you can see that there. All right, great, Amy.
If there's if anyone
Can I?
Sorry.
Go
for it, Claire.
Hi, Claire.
Hello. Hi, this is probably only really for me, so I apologize to everybody else. There is a fairly good chance I'm going to be moving to the other end of the country during this process. So I mean, obviously currently working for the NHS, and hopefully we'll get another job in the NHS up in Cumbria. However, if, you know, provided that is the case, would I still be okay to do the programme if I'm changing jobs halfway through?
Yeah,
the
that's
year?
fine.
Oh, okay,
often clinical entrepreneur, obviously people move around a lot and change jobs but stay within the NHS, particularly junior doctors, don't they? They're all over the place and all over the country. So yeah, that's absolutely fine.
Brilliant. Thank you very much.
I think that actually brings it like to a really good point that some people do actually raise. They go, if I change my idea a couple of months in, so not just their employment, but their idea, can they still stay on the programme? Yes, you absolutely can. A lot of people come on the programme, they learn some things, they connect with the rest of the community, and their idea pivots and changes, and they get worried that they can't stay on the programme. You absolutely can. It's kind of part of the process, isn't it, Polly? You know, we have a lot of entrepreneurs that pivot, so please don't worry about that. Yeah.
And if you apply and are successful and that happens to you, we're happy to have a chat with you about that, and we can get you some help with like reforming the ideas or changing or whatever. But yeah, it does happen. I wouldn't say it happens a huge amount, but we do get clinical entrepreneurs that apply with things, and as Lucy says, they start coming along to the sessions and they start working on it, and they think, well, actually, I don't think this is going to work in the same way, and I need to change it slightly, or massively. So yeah, so that does happen. Are there any other questions? No, there doesn't seem to be. So thank you for joining us tonight and giving up an hour of your Wednesday. I was going to say Thursday then, because I'm not quite sure what day of the week it is currently. If you have any, there are further sessions if you want to come back. If you have any questions, I'll just chuck the email address in the chat, and we'd be happy to reply or arrange a time to speak to you if you want to go through anything in detail. We can't offer advice on the idea you're applying with, but we can help you with the application, and it sometimes helps to talk through it with someone as well. So yeah, just use the email address and get in contact if you've got any questions after this. But thank you for joining us this evening, and good luck with your application.
Oh, we've got a question.
Oh,
sorry.
question.
Oh, got a last question.
Oh, go on.
Can ideas be around linking services that usually work in silo together to integrate and improve patient outcomes or prevent disease? Yes. That is a yes, Green. Yes, definitely. Sorry, I've got one other thing to add, Polly. Apologies. In the next session, we'll probably just dedicate a little bit of time if some of you want to practice your pitch. So you'll get a bit of feedback from us. If you want to do that, we'll make sure there's a bit of time for you to do that if you're brave enough and you want to. Some people like to have the practice. So yeah, if you can come along to the next one, we'll make sure there's a bit of time there for you. Anything else? Any other questions before we go? I think that's it, Paul.
Thanks, everyone. See you.
Thank
Bye.
you. Bye. Bye.